Hello everyone, it's me Dr. Mohammad Naseem Shirzad, and today I'm going to talk on PSA. PSA means prostate specific antigen. I will be talking in a very detail regarding the PSA, that what is PSA, what its function, what its clinical importance. So PSA is actually a prostate specific antigen, and it is 34 kd by weight. By molecular weight, its weight is 34 kd, and it is a serine protease, and it is a organ specific but not cancer specific. This statement which I am giving, that it is a organ specific and not cancer specific, this will help you while counseling the patient if you are going to advise him PSA level. Like PSA can be rise in any condition that manipulating the prostate, like it is only produced by the prostate gland. There is no other organ in the body to produce a prostate specific antigen. So it is organ specific, mean it only and only produced by the prostate, not by any other organs. But it is not a cancer specific. Like if a patient is having abnormal PSA, it doesn't mean that the patient is having PSA level. Normally, each and every of a male human having PSA level in their blood, but its rise doesn't mean that the patient is having cancer. If I advise any patient that you have a PSA of 10, it doesn't mean that the patient is having a cancer. It can be rise because of prostatitis, it can be rise because of UTI, it can be rise because of the catheterization. So any things which manipulate the prostate, that increase the prostate PSA level. That's why we giving a statement that it is not cancer specific. So while giving the counseling regarding the PSA level, if you are advising, you must tell him that this level is, that PSA is present in each and every male human blood, and its rise level doesn't mean that the patient will be having cancer. So these things are important. Now PSA is also known as HK3. HK3 means it is from a family of cheliocrines family. So PSA is also known as HK3. And what is its normal biological function in a blood? So the normal biological function of this PSA level is just to liquefy the seminal coagulum within the ejaculate, and this will help in the fertilization. And the level of PSA is million times more concentrated in semen as compared to the serum level. And if we discuss the normal PSA level, so there is no normal PSA level, I means in cancer disease. But regarding non-cancer patient, the normal serum concentration of serum in a patient age 50 to 80 year without any prostatic disease, it is 1 to 4 nanogram per deciliter. So its normal range in non-prostatic without prostatic disease in a man with age 50 to 80 year, that is 1 to 4 nanogram per deciliter. PSA is a glycoprotein, and it contains around 70% of carbohydrate. PSA is encoded on chromosome 19. It is important to have a concept of these things, and it is acting as a serine. Now, when we are advising any patient PSA test, so what does it means? It is actually a total PSA. PSA exists in three form in serum. One is the complexed PSA, the second is the unbound or pre-PSA, and the third is the enveloped PSA. The complexed PSA is the one which is bounded with alpha-1 anti-chymotrypsin. And this is called complex PSA. The second is the unbounded PSA. The third is the PSA which is bounded with the alpha-2 microglobulin. So what does it means? That the PSA is exist in three form. When we are talking about total PSA, so it is a combination of complexed PSA. Complexed PSA mean PSA which is bounded with the alpha-1 anti-chymotrypsin, and the one which is pre or unbounded PSA. So the enveloped PSA which is bounded with the alpha-2 microglobulin, that cannot be detected by immunoassay. So that should be kept in mind, that complex PSA, the total PSA is a combination of complex PSA, and that is a total PSA. Number second, the unbounded or pre-PSA, its half-life is 2 hours, and it is filtered or cleared by the kidney. while the majority, the complexed PSA, which is bounded with the alpha 1 anti-chymotrypsin, its half-life is 4 days and it is cleared by liver. The one which is bounded with the alpha 2 microglobulin, its half-life is also 4 days, and we are not using it for measuring purpose because we are unable to measure it by immunoassay. So this concept is important. Now there are some important calculation I want to talk on them, like pre-PSA level that is not affected by finasteride. That's why when we are saying that we are advising pulpa reductase inhibitor to any patient, that decrease the PSA level, but it is having no effect on the pre to total PSA ratio. So this pre to total PSA ratio is also important. I want to talk on them because this is important in a condition if a patient present to you with a PSA level of 4 to 10. This 4 to 10 is called the gray zone, and that is the called the we are saying actually a diagnostic gray zone. We are not deciding what the patient is having. So the calculation of this pre to total PSA ratio is important, and this pre to total PSA ratio is very high in BPH, and it is very low in CA prostate. So pre to total PSA ratio, which is very high in BPH benign condition, but it is low in CA prostate patient. Why we are doing this? Because by calculating this we can avoid unnecessary biopsy. Like if a patient is having 8 PSA and you are going for prostate biopsy, so you can avoid these unnecessary biopsy by around 20 to 30%. So by calculating just this pre to total PSA ratio, and this pre to total PSA ratio only we perform that when a patient present within diagnostic gray zone. Diagnostic gray zone means when a patient is having PSA of 4 to 10. This is called the gray or diagnostic gray zone. The other important thing is the PSA density, and the PSA density is also important in a condition if you are having no MRI. So you can decide on the basis of this PSA density as the patient need biopsy or not, and it is calculated by we are actually dividing the serum PSA divided by the prostate volume. Now how to calculate the prostate volume? The prostate volume is calculated by the ellipsoid formula, that is equal to height multiplied by width multiplied by length multiplied by 0.5. So we dividing PSA divided by the prostate volume, and when it is more than 0.15, we are labeling that that a patient is a suspicion of cancer, CA prostate. When it is less than 0.15, it coming in a benign condition. So by the way, PSA density and pre to total PSA ratio, this is going in opposite direction. In CA prostate, the PSA density is high, while pre to total PSA ratio PSA ratio is low. So this going in opposite direction. Pre to total PSA ratio is very high in benign condition, while PSA density is very low in BPH. Terminology is the PSA velocity, and we defined PSA velocity as the rise of PSA per year. And when it is increasing more than 0.6 to 0.7 nanogram per ml per year in at least three separate tests, then we call it as a PSA